Hey there, and welcome back to my Heart Health series. I'm Dr. Misty Sens. I'm a chiropractor and functional medicine practitioner. Today, we're going to talk about eating for your genes. Because have you ever wondered why some diets work for some people and not for others? Well, the answer is in your genes. So, listen, we are all dealt a hand in life. The question is, what are you going to do with the hand that you're dealt? Listen, your genes aren't your destination. You can turn your genes on and you can turn your genes off. If you know you have a family history of heart disease or diabetes, you should be doing everything that you can to prevent that. But knowing what your genes are will help you reach that destination faster. So listen, you can turn your genes on, you can turn your genes off. It's totally up to you and what you decide to do in your lifestyle. But today we're going to be talking about nutrigenomics. And what that means is how our genes and our food interact. And the reason why we do this in functional medicine and we look at nutrigenomics is because it helps to personalize functional medicine for you. There's nothing more personal than your blood and your genes. So knowing how your genes interact with your food helps us to prescribe the best course of action for you in terms of diet, supplementation, and lifestyle. Today, specifically, we're going to be talking about APOE testing. APOE is a genetic test that aids in the selection of optimal cholesterol lowering protocols. And depending on your APO genotype, cholesterol lowering dietary interventions are very effective when we combine it with metabolic typing. So as I said, we're going to talk about APOE. This is the biochemistry and genetics of the individual. There are 3 types of APOE. There's a 2, there's a 3, and there's a 4. That third column should be a 4. But this is looking at how your APOE type responds to diet and exercise. So really quickly, let's just look at the APO2. So if you're eating, if the person that is a type 2 is eating a carbohydrate-rich diet, guess what? That may worsen their lipids or their cholesterol. A high-fat diet may help their lipids. And protein may actually lower their LDL or bad cholesterol. So isn't this important information to know? So what type are you? We're going to dive deep into that right now. We're going to start with the 3. And I'm going to use animals as examples. So the APO3 is a bear. And a bear is an omnivore. They like to eat a little bit of everything. But here's the thing. If the bear is not eating for its genetic type, let's say they're eating a ketogenic diet, they're not going to be healthy. If they're eating low carb, they're not going to be healthy because they like a balanced approach to food. 65% of the population is a bear, and the APO3 is considered neutral when it comes to chronic disease because chronic disease is only triggered by poor lifestyle choices in this genotype. We call the bear a mixed type because, as I said, they like a little bit of everything. In terms of the bear, if a bear has high cholesterol, diabetes, obesity, metabolic syndrome, or any other chronic illness, it's most likely that it was turned on by lifestyle. So lack of exercise, smoking, poor nutrition, overeating. Bears do not have the high predetermined susceptibility like the other 2 food types do. When a bear sits down to eat, when we look at a bear's plate, 50% of the plate should be complex carbohydrates and 50% of the plate should be proteins and fats. Now, in terms of the APO4, we call this a deer type. Deers are herbivores and they love to eat plants, right? So if you feed a deer a high protein and fat diet, what's going to happen? They're going to get sick. Deers are 25% of the population, and they are considered high risk for heart disease and Alzheimer's. Wouldn't you want to know this? Deers are a carb type. They're herbivores, so they like to eat a lot of plants. Plants are considered complex carbohydrates, so that's why they're called the carb type. When we look at the plate for a deer, 60% of the plate should be complex carbohydrates and 40% of the plate should be proteins and fats. I want to talk a little bit more about the deer's risk because, as I said, they have a higher risk for cardiovascular disease and Alzheimer's. I mean, if you have the 4,4 APOE type, it's twice the risk of cardiovascular disease. Your LDL cholesterol and your triglycerides are going to be higher if you're not eating for your type. There is a high incidence of not high incidence of multiple sclerosis, but if you have multiple sclerosis and you're an APO4 type, there's going to be a faster progression of that disease. There's higher risk of sleep apnea and HIV progression, meaning if you have HIV, you have a higher risk of progression of that disease. Some other risk factors with the deer: high fats will exacerbate disease in a deer type. Higher doses of omega-3s increases the bad cholesterol. So while omega-3s are critical for health and well-being, and they actually do help to lower LDL cholesterol in other types, in the deer, too much omega-3s will actually increase that bad cholesterol. So we have to know what type you are, especially when we're dealing with your cholesterol and helping with nutritional protocols for lowering it. High doses of saturated fats increase dementia in a deer type. Alcohol will exacerbate disease. Sedentary lifestyle exacerbates disease. I mean, think about it. Deers like to run, right? So if you're sedentary and you're a deer, you are at higher risk for developing heart disease and Alzheimer's. As a matter of fact, 77% more likely to get dementia being a deer. And here's the other thing about a deer: they have a reduced ability to detoxify harmful chemicals. So the poor deer has really been dealt a hand, but it's so important to know what you are to be able to handle that. Now, the last type is the APOE2, and that's the tiger. So what do tigers like to eat? They love to eat meat, right? So if you were to feed a tiger a high carbohydrate diet, what do you think is going to happen? Diabetes, right? So tigers are only 10% of the population, and the APO2 is considered a high risk for diabetes. They are the protein type because they like to eat protein. A tiger's plate is going to be 70% 70% protein and fat, and 30% carbohydrate. Complex carbohydrates, by the way. Some additional risks for tigers, okay? They may have an increased risk of Parkinson's. We need more studies on that, but there has been a link. Hyperlipoproteinemia, which means elevated cholesterol and triglycerides, especially when they're not eating for their type. An orange discoloration within skin creases, meaning they have a high amount of insulin. They have an elevated risk for psoriasis, and as well as multiple sclerosis, meaning if they have multiple sclerosis, they have a higher frequency so if they're APO2 type, there is a higher risk and a higher frequency of developing multiple sclerosis. Some other risks: an increased risk of diabetes, as we've just spoken about. Elevated insulin levels. Insulin is a fat storing hormone. So if you're a tiger and you have high insulin, you're going to have fat around the middle, and then elevated triglycerides, which those are things that you don't want in your bloodstream and hanging around your heart, right? So who wants to know their blood type? I hope you want to know what your blood type is. It's so critical to actually approach health and wellness from a functional medicine standpoint, utilizing nutrition and supplementation. As I said, we can get very personalized. Knowing what your genes are and knowing what type you are can really dial in your nutrition so that we can prevent the chronic diseases that I spoke about, or if you are already dealing with them, to help your body reverse that process, utilizing some very specific nutritional protocols based on your genes. So next time you're here, we are going to talk more about the next genetic type we do that can affect your heart as well as other processes in your body. And that's the MTHFR gene, which looks at how your genes will break down certain nutrients. So I hope you come back and you check out that workshop, and we'll see you then.